Okay, so now we are going to talk about how to operate in the room during your simulation. And so one of the first things we're going to talk about is telemetry. So if your patient requires telemetry and you need to put them on a monitor or something like that, you will actually connect electrodes to the telemetry and you will put it on the simulator. Okay, this is always usually sitting on the crash cart right there. So if you need it, that is where it will be. And you will actually apply the electrodes to the simulator. All right. Next thing is going to be the PPE cart. So there's a PPE cart. Turn that right a little bit. Right here. And when we have PPE for your simulation, we want you to put on the gown. If you're in droplet or contact isolation, we want you to actually put on the gown. And just so you know, like not all facilities are going to have the same stuff. So some things are going to look foreign, like this one. So when you put it on like you would in real life, okay? And of course you would put gloves on, which you'd already do when you come in the room. And then you're also going to make sure that you tie it all up, okay, so that you are protected. And then you are going to put on goggles if you are required to wear that for your droplet and contact isolation. Okay, but we will not put on a mask because it's already hard to hear people, so you do not have to wear a mask during simulations in this situation, but I would like you to verbalize that I would put on a mask during this time. In isolation situations, generally there is an isolation stethoscope in the patient's room, and we would just like to hear you verbalize that you wouldn't be using your stethoscope on an isolation patient and then on another patient back and forth. So that's how you're going to do your isolation gear PPE. This patient also has SCDs on. So when you're checking your patient, make sure that you look at the whole picture. And you guys can actually take these off, check the legs, do a skin assessment, the whole 9 yards. But always make sure that you're checking your whole patient when you are coming to a simulation. He has a call light, he has personal belongings, his hat, his glasses, his watch. Think of a sim area, kind of like the game of Clue. Everything in the room is kind of for you to figure out and to assess. He also has food and menu options for meals. And so when you come to Sim, you will have 2 trays. You will have 2 trays and they will have food on them. And you will be able to pull this off when we tell you to. And then this is where you will have your option for what you want to give the patient for a meal. And when you're doing that, you also want to look at the menu. We have a Black Hawk menu that you can go through. We'll explain that a little bit later. But this is also going to be in the room so you can help the patient decide what they're going to have or what they're going to eat. And then you can choose what they want. Our food looks really realistic. And so we will hope that you guys can communicate with the patient and help them make a decision that best fits their needs. Lastly, when you're working with the simulators, some of your simulations may have a Foley catheter. The catheter is never actually inserted into the simulator, it's just tucked underneath the bed. But if you see one hanging like this, and this one has liquid in it, you should assume that the patient has a Foley catheter and that it's functioning at this point, because you're going to assess this and see how the urine looks and whatnot. I want you to go through the motions of how you would assess if this Foley catheter is in place and it's functioning as it should be. And then you'll just set it here. If you would want to empty the catheter or empty the bag, you can verbalize that as well. We'll just leave the liquid in there for future groups. I think that is it in terms of how to operate different items in the room. Like as always, if you have a question and you're wondering if it's a simulated environment or if this is supposed to be that way or this way, just say, hey, Christy, sim question. Hey, Ashley, sim question. Am I supposed to do this or that? And then we'll help you along the way.